Navigating US healthcare is hard, and even more so if you or your loved ones are facing language or cultural barriers. My parents immigrated to the US 40 years ago. They've lived and worked here, but as they've gotten older, I've noticed that I've needed to step in to help them with healthcare questions more and more. I've gotten the frantic text while I'm at work, asking where to find a doctor, what to do about an existing condition, and feeling helpless and confused and not really knowing where to send my parents next. Families like mine aren't unique. Millions of aging Americans face these questions, and missed medication, delayed care, and worsening health outcomes are costing our healthcare system billions of dollars each year. And new digital health solutions are really only serving English fluent audiences and not taking into account cultural nuances or family dynamics in the design of their products. In fact, Hispanic and Asian Americans are the fastest growing group within Medicare. Yet the traditional healthcare system's one-size-fits-all approach to care really doesn't make sense anymore. My co-founder and I see the language and cultural barriers that face our communities, and we know that this burden often falls on the shoulders of younger, more English fluent loved ones, folks like her and myself. And this is a growing underserved population. And as much as myself and my co-founder want to help our families, and as much as we love them, there's not really great tools to help us with their healthcare, leading to more stress and confusion. When we interviewed over 270 different stakeholders within healthcare, the number one question we heard from patient family members was, what do I do next? And so that's where we come in. We're the digital platform for families to support their loved ones' care in their preferred language and cultural context. We're starting with care navigation, adding in telemedicine and virtual care, and ultimately becoming that one-stop shop for you and your multicultural family's healthcare needs. Our beta product is launching later this year, starting with a care roadmap, helping people figure out what they need to do next, with organized suggestions based on what clinical guidance says, as well as what's covered by insurance. We're offering user-generated reviews of doctors in your local area as we grow. So we're basically systematizing the word of mouth that already happens within these communities. Third, we're including preparation and access to care so the whole family can be aware of the notes, and something as simple as an intake form will no longer be daunting for these patients. Finally, we're monitoring and reminding patients and their loved ones about the medication, exercise, and appointments that they have upcoming, so nothing slips through the cracks again. We've tested our proof of concept earlier this year with the COVID-19 vaccination, really understanding how information gets transferred within these families. We've brought on an excellent team of advisors and backers to support us in this journey. We'll be launching our first product later this year, starting in Spanish and Chinese. We'll be the first-in-class digital health platform for the largest underserved population within healthcare, and helping families like ours finally get the care that they deserve.